Hi, so we're on chapter 6, which covers trauma and stress-related disorders. And I want to begin by highlighting first the difference between the sympathetic and the parasympathetic nervous system. Most of you are familiar with it from previous classes, even from the textbook, because it does get into this topic as well. The stress response that we typically experience with anxiety or trauma-related disorders or stress is part of the sympathetic nervous system arousal or the fight or flight, which we have in order to increase the likelihood of surviving a highly dangerous situation. So for example, if I encounter a mountain lion, I'm going to get a little stronger and a little faster to fight it off to increase the chance that I can make it. Okay, and this is the type of arousal that we see very often quite heightened with trauma and stress-related disorders. The parasympathetic nervous system is the relaxation response, the restoration response. That's the kind of system that kicks in as soon as we get a massage or when we sit on the beach and watch the waves and things like that. So when we talk about trauma-related disorders, one of the most commonly assigned trauma-related disorder is PTSD or post-traumatic stress disorder. Okay, now in order for someone to receive the diagnosis of PTSD, they must have a history of trauma. If someone has a lot of symptoms that look like PTSD, but they have no history of trauma, then they would typically receive a diagnosis of one of the anxiety disorders, but it would not be PTSD. And a hallmark of PTSD is that the person is haunted by the trauma. So they experience flashbacks, intrusive memories, or nightmares that relate to the trauma, to the traumatic event or traumatic events. And they're typically unwanted. People want to avoid the reminders of the trauma. People try to resist and avoid these experiences, but they are nonetheless intrusive and keep coming back. A lot of people with PTSD have hypervigilance and heightened startle response, mood changes related to the traumatic experiences, even guilt. Even though they did not cause the trauma or did not contribute to the trauma, they still feel a sense of guilt. It's a very common part of PTSD. If a person has symptoms of PTSD that last less than 1 month, then the diagnosis would not be PTSD, but acute stress disorder. Okay, I want to very briefly talk about some treatments for PTSD and other trauma-related disorders. So one of the most common treatments is called prolonged exposure. Prolonged exposure is sort of like what it sounds, okay? The person is exposed not to the traumatic event, of course, but to the memories of the event. So the person will be asked by the psychotherapist to write everything down, everything related to the event, which is typically quite difficult to do, and then read it out loud over and over again. Now, this does need to happen, of course, in the context of psychotherapy sessions that are led by a trauma specialist, someone who is well knowledgeable about these types of treatments. There is typically a fairly strong component of relaxation where people learn how to relax, how to get into a state of parasympathetic nervous system arousal before they start writing or reading the account of their traumatic experiences. Another type of exposure therapy is called EMDR, eye movement desensitization reprocessing therapy, that has been shown to relieve the symptoms of trauma-related disorders such as PTSD in a number of different patients. Again, this is something that would need to happen under the guidance of a highly experienced therapist who specializes in treating trauma. So we're going to pause here for today. Thank you for your attention, and I will see you next time. Bye.